Welcome everybody. The meeting will be recorded and available on the website afterwards. Please do use the chat facility or the hands up facility. The more interactive, the better. We won't get everybody to introduce themselves today, but if you do want to say something, if you could introduce yourself and say where you come from, that would be really useful. We've had a few apologies through. So we've got Rob from Skillsacare, Graham from UKHSA, Maria from UCL, Katie Thorne, Digital Social Care, Sue from Summerlands, Mike from the OS, and Nicola, who's a relative. But I haven't received any other apologies apart from that. Fantastic. So just to go through the action points from the previous meeting, a lot of it we've got covered on the agenda anyway, but we haven't received any written feedback about the website, but we've got that on the agenda for later on so we can go through the website should people want to. Frequently asked questions, that's to follow. Mike is on paternity leave now, so he's working on that document. He'll be back in April. We're going to invite Nourish and PCS along to the next meeting. Nourish is certainly at the stage now where they want to put live the button for the opt-out on Nourish's system, which is fantastic, although we won't be collecting data yet. To have that facility for providers to use is fantastic. We're drafting up the comms plan, so that is in progress at the moment. Jenny, our new comms and partnership lead, is working on that, and I think Jenny has booked a demo for Recite Me for the accessibility tools. Has anybody got any questions around the action points that were sent out following the last meeting at all? No. Fantastic. Excellent. I'm going to hand over to Laura to give us an update on the project steering committee and SOG. Thank you, Laura.
Great. Thanks, Zoe. So hi, everyone. Nice to see you all, and thank you so much for joining. We had a steering committee, our first steering committee meeting, feels like quite a long time ago. And the point of that meeting was to get together with stakeholders from across organisations. So CQC were involved, NHS England, UKHSA, to try and make sure we had that really sort of broad representation of all the different organisations who might be interested in this project. And it was really an opportunity to just explain what we're doing again, and to think about the kinds of things that we would like to measure, and particularly to make the point again about how important it is that this is care sector led, and that we think very carefully about what we're measuring and what can be fed back at sort of national level or at care home level, recognising all the concerns from the sector around how these data are used. So it was a really, really positive meeting. Everybody was very keen to be involved and also quite keen to sort of think about the future of this project and how we might be able to expand the scope of what we're doing. So all really, really positive. And then in terms of our stakeholder oversight and governance group, so the purpose of that group is to really keep a very close grip on, or a tight grip on how we're using the data. And so again, it was thinking in more detail about what we're going to be measuring, what those outputs are going to look like when we start to create the dashboards, and thinking about how we make sure that we are hearing views from people in care homes about what we're doing, and really having that kind of loop between this is what we're proposing, going back to stakeholders, does this look okay? Are there any things that we need to revise and change our approach? So all in all, good progress. I think our key challenges remain about the data pipelines. So you won't be surprised to hear moving data around is hard. And so trying to get all of that infrastructure set up is quite challenging, but we are making really good progress. In terms of the governance, all of that is in place, so that's really important. And yeah, I think we're things are going well. One thing I can mention that is really exciting is something we've talked quite a lot about is it feels like we are getting a network in place. So we're getting care homes that want to take part. We're getting the linked data in place. That's excellent. It means that we can do the kinds of research and that we want to do. But what the missing piece is really around having people in care homes who have the confidence and knowledge to talk about research and to start thinking about the kinds of research people in care homes might like to see. How do we build that capacity in the care homes themselves? So it's not people like me coming in and saying, let's do this research project. It starts to be much more care homes saying, well, this is what we care about. This is what we'd like you to do research on. And so the good news on that front is we're making real progress in terms of thinking how we can provide funding to providers to have people in care homes who have time bought out so that they can start doing training and thinking about research and the kinds of research they would like to do. So yeah, all going well. I'll shut up.
Thanks, Laura. Has anybody got any questions for Laura around any of those groups? Francesco?
Oh, you're on mute.
You're still on mute. No. No. Okay. Anybody else? Any Asa, do come in.
Hello, I'm Asa from Anchor on the care services side. So that's great, Laura. That's really, really exciting. Obviously, being part of the Valdi study is one element of research that we want to be involved in, and we've got other research projects currently running, one around music therapy and some others as well, which is really exciting. So when you talk about this opportunity for research within care homes and potential grants, are we talking broadly in terms of looking at lots of different areas and aspects of care service and delivery, or are you thinking more specifically in one particular area, i.e. like this around IPC?
Yeah, so I think what we have to do is, obviously, to do research, we've got to get money to do research. We have to get the funding. So I know that there is a bit of an open door around evaluating vaccines at the moment on the back of COVID. So there are new vaccines coming onto the market. So, for example, against RSV, respiratory syncytial virus. Also, there's a new norovirus vaccine that's coming online. So there is a lot of interest in trying to evaluate those vaccines in care homes. So if the care homes that we're working with could see the value in taking part in those kinds of studies, that would be a very, I wouldn't say easy, but that would be a very logical first step for us, I think. More beyond that, absolutely the idea here is that we're setting up the network and infrastructure to enable a whole variety of care sector led research. So the idea being that it isn't us saying, oh, this is the thing I'm interested in, so this is what we should do. It becomes much more, what do the care sector want to see research done on? But we do have to play the game a bit because, as I said, you've got to get the money. And we've also got to fairly quickly, demonstrate the value of what we're doing. So I think if we could have a big vaccine trial, that would be a real win, provided that was something that was acceptable to the people we're working with, obviously. Yeah.
Thank you. Does that answer your question, Asa?
Yeah, thank you. Thanks.
Any other questions for Laura? Are you staying for the whole meeting, Laura, or do you?
Yeah, I can do.
Yeah,
I can do. Yeah.
Lovely. Excellent. Francesco, do you want to see if you can come back in? I think you've got your hand up. If your unmute works. Yeah.
Can you hear me?
We can hear you. Yes. Yeah.
Yeah, I'll just check with you because I'm sure it'll be covered by Chris Carrigan, who was here last time, right? Are they going to use my data? Are they going to still be involved?
Yeah, definitely.
Forward?
Yeah, absolutely.
Okay.
Involved. Yeah.
Okay, the question I would have is, I've seen High Court judgments about the use of holding people's data when it's shared across physical and mental health and such forth. And when there's ongoing delivery of services, then, it's been put at 20 years. But with research projects, if you're not going to use, or you will use Section 251, then, holding it for time makes no difference because it's anonymized, or in most cases it would be. So is there any indication how long, if people decide to leave before the end of the project, The clock starts ticking. And for people that stay the full duration, what is it, 5 years that the data's held?
Yeah, so I will have to double check. There are rules at UCL about how long data can be held for research purposes, but that data is anonymised. And so I think it's years, but that's the anonymised data. So for the data that's held within the Foundry, so in the NHS England environment where we will be doing the linkage, that will be pseudonymized data. As things stand, that data will be only live for the duration of the project. Obviously, if the project continues beyond that, then we will look to continue doing this, hopefully on a long-term basis. But yeah, the pseudonymized data will not be held for long periods of time. No.
Okay, that's, I mean, yeah, just obviously going for the section 251 comes with it the requirement at your end to provide for a full opt-out, partial and full, and that will be assured, yeah?
Yeah, absolutely. Okay. Absolutely. Yeah. And every year we have to, because we've certainly become quite familiar with section 251s because we've been doing this now for a while. So every year you have to report to the confidentiality advisory group and give a progress update, and you have to explain how during that year you have worked with the care sector to assure yourself that this is still an acceptable thing to do. And so we have to provide evidence on it on a rolling basis of that, and that's one of the roles of this group, is to do that oversight of information coming back in from the care homes.
You I don't know, when you look at accreditation of courses at university, nursing, midwifery, you have to have people that use services as part of the stakeholder panel that speak to the quality assurance advisors. In that situation, reporting back every year, do you or when you do, will you be looking to get third-party comments from people that are family relatives or such forth? Yeah, okay.
Yeah, definitely. Thank you. Yeah, and Zoe, you're already collecting those, aren't you?
We are. Yeah, absolutely. Absolutely. That's all happening in the background already. Yeah.
Okay, great stuff. Thank you.
Great.
Fantastic. Thanks, Francesco. No other questions. I'm going to move on to a general project update now, and it will combine quite a lot of the agenda. We're delighted to have some of our providers with us today who are also going to feed back, which is fantastic. So we've got lots of care homes still signing up, which is absolutely amazing. For those who've looked at the website, the team's busy inputting all of the different care homes that are involved across all the different ICBs. We haven't got everybody uploaded at the moment, but so far we've got 25 ICBs covered. So we have got a very good spread of care homes across the UK. The training, we've now trained 63 homes who have actually completed the training. We've got 119 booked in for April, and then we've got dates planned from May onwards, once a month, which is absolutely amazing. What we are doing with the training is having meetings to see how we can review it. So how do we measure how effective it is? I don't know whether, Laura, you want to come in and give a bit of an update on what we're proposing in terms of reviewing the training, if you're still with us. Yeah.
Yeah, I can do. You put me on the spot there, Zoe.
Sorry, Laura.
That's all right. That's all right. So training. Wow, there's a lot going on with training. So what we have is we have the training that Zoe and colleagues have been doing in the care homes that are taking part already, which is going really well. And so that involves going out and is largely focused around the delivery of this project. So we've been talking to the National Institute for Health and Care Research, who are the biggest funder of research in the country. And they've said to us, well, that's great, but can you please evaluate this? And the reason they're asking us that is because we've been saying to them, this is going really well. We would really like you to invest in the development of this programme more broadly so that we can do more. And so what we've been able to do is get some funding for a person who's going to come in and work with us to try and more formally evaluate that, so that we can write it up as a research study and explain how this training program is working. And then the good thing about that is it means we will have a product that we can share with the funder towards the end of the project as a sort of starting point for the next version of the training programme. So all of this is trying to learn as we go and do more as we go, starting slowly, building on what we've learned, and then seeking more and more funding. And where we're trying to get to is where we might be able to get funding for maybe between 300 and 600 people who would have money. So these would be people who work in care homes who would get funding so that they have ring-fenced time to focus on research in their care homes. And so it's all about this, trying to build this capacity in the care sector for care sector-led research. I hope that makes sense.
Thank you. Thanks, Laura. Excellent. And I think just to reiterate that the training is co-produced with Skills for Care, UKHSA, UCL. So you have academics on the training, you have providers and Skills for Care as well, which is fantastic, and hopefully our providers that are on the call today will be able to give some feedback around that. So other updates from our end, the animation, you may have already seen it. We've now got we had an interpreter has signed to the animation, and we've got the script at the bottom, which it looks fantastic. It's available on the website now. Easy Reads, we've got a company who is transforming all of our documents into Easy Reads for us. They actually start the work in May. The documents will then need to go back for ethics and approvals again. But Laura assures me that process won't take as long as obviously our original CAG approvals. The website, has anybody got any comments? Have you managed to look at the website? Is there anything that you would like us to change, to add, to alter? It's obviously work in progress and we can change things as we go along. But it's good to see that there have been lots of downloads for the information leaflets and the posters that are on the website. So that's fantastic, as well as providers having the documents. People are obviously going online and downloading those as well. As we've always said, we want to be as open and transparent as possible by having things available. No comments on the website. Fantastic. We've had one more care home visit with the Vivaldi social care team. This time it was in London, and that was very, very well received again. And it's quite interesting. It's as part of the pilot, it's bringing up lots of different questions. It was a care home that has uses a private GP, for example. So it's raised the questions as to how do we access those records, as well as just through the NHS numbers. So it's great that we're going out to different providers to establish problems that we may incur throughout the 12 months. I'm going to hand over. I'm going to ask Luella, if you're still on the call. You are you happy to feed back and tell us about your home and feedback on the training and how your conversations are going, please?
So when the Vivaldi team came here, I think that was January. It was in our lounge with the residents, a family member, and half of my team, I think, has joined. So the residents are quite excited to join. I think one resident already said, "Put my name, where do I sign?" So he's quite excited. The good thing is Sue, a family member who was present in that training, she starts to advocate to other family members. So that is really helpful, so that we have a family members who can talk to other family members. So far, so good. We don't have any family members who have opted out. I think we are now in the next stage wherein we have to inform the new residents, because we have 3 new admissions over the last month. So it's more of letting this family understand what is Vivaldi, what is this research, and the benefits. So the website, the information on the website is quite helpful. So once they have read and have watched the video, so there's not a lot of explaining for us to do. They will just say, "Okay, no problem." So easy peasy. Thank you for everything, Zoe and your team. So far on our end, we're fine. We're doing well.
Amazing. That's fantastic. And thank you for the photos you've been sending as well of the materials that you've been using. I'd just be interested to know, are there any difficult questions coming in that your team have found hard, or as you say, with the animations and the leaflets, do you think that the materials that have been developed are sufficient to answer those questions?
I think with the staff, they are asking whether there's more data they have to do or additional job they have to do. I think they're quite excited when I just told them that nothing, all they need is just NHS number. So I think that is a common question when it comes to the staff. Family members is more of, will my mom's or dad's data, will it be publicized? It will be in the website, their names. And I said, no, it will be anonymized. And once, I asked them to have a look at again the website. It's all in there. It's quite clear. So they start to understand. So that's common question. And I think another is, when are they going to start? That's the next question. And I said, don't worry, we'll keep you posted.
Fantastic. Oh, that's brilliant. And that's really useful to know, actually. We're going to be having our next drop-in session on the 3rd of April, and we would like to invite residents, relatives along to that. It's just a 30-minute drop-in session, but I think we'll build that into our communications plan as well, because people do keep asking, when are we going to be starting? So maybe we need a Vivaldi project update on timescale. So thank you very much, and yeah, thanks for being here, Luella. Lovely. Can I come over to, I think we've got Kate on the call, Kate Collins from Bracebridge.
Hi, good morning.
Hi there.
So pretty similar, really. We've had some really positive comments from family members and from residents, and they're excited to get going. So I think the main question is, when is it going to start and what do they have to do, obviously. So we're sharing the information on the website, and I found that really useful and quite easy to navigate. So yeah, we've had nobody wanting to opt out, and no sort of bizarre questions or unanswerable questions so far. But if we do get any, we'll definitely feed them back.
Fantastic. Thanks, Kate. That's really positive. Has anybody got any questions for Luella or Kate at the moment? Francesco.
Oh, it's working. You can hear me?
Yes.
Yeah, just a quick question. We're told that you only need a couple of bits of information to identify someone, whether it's a national insurance number, NHS number, but I've heard reference to requirement for an NHS number. What's the relevance of identifiable information like that? I mean, it may well be it's all okay, but I'm just curious.
The only piece of data that we're collecting is the NHS number. Not the national insurance number, it's the NHS number.
That's what I have to, in order to, when I recently updated all my details around for research and otherwise, I had to provide my national NHS number as well as my date of birth and surname and that. So I just wondered whether or not it's relevant.
Laura, did you want to come in there?
Yeah, I mean, so for this first phase of the project, for all the reasons that we've talked about, so trying to keep this as simple as possible, trying to make sure there isn't additional work for providers, the whole system is based on NHS numbers. And so that's the only information that we're pulling from the digital care providers. And that number is going into NHS England, where it gets converted from the real NHS number into a pseudonymized NHS number. So basically that means something that's linked to the NHS number, but not the NHS number. And that then can be used to link across to all the other data sets that are already held by the NHS. So we absolutely will not have national insurance numbers or anything else. We will just have NHS numbers initially, but they then get converted to this other number that's linked to NHS numbers, but that doesn't identify anyone.
That explains it. In a world of patient information summaries and valid informed consent forms, templates and that, you know, I was just thinking, but yeah, it kind of like makes sense, but I'm not the expert. I will take your word for it, Laura.
Great.
Thank you.
Great.
Thank you.
Good.
Thank you. And have we got Alex or Helen from Stowe Healthcare?
Hi everyone.
Hi there.
We don't have Alex, unfortunately. She's had to be called away, but my feedback from Great Hawksley Manor has been really positive. Last night we had a relatives meeting, and we were able to talk about the project at the relatives meeting, and everybody was really excited about the big picture stuff and the public health implications moving forward. And there was really a lot of excitement from relatives, and they were almost kind of asking that, blimey, why has it taken us all so long to get to this point where this is how we start to conduct meaningful research? It was really very positive. So I think we've really moved quite a long way in terms of that engagement with people who are using the service.
Fantastic. That's excellent to hear. Thank you very much. Are there any questions at all for any providers, or are there any other providers that I haven't mentioned that are on the call that would want to feedback as well? No. Excellent. Well, I think that's really good to hear the positive feedback. So moving on, I just wanted to ask, I know Diane kindly offered at the last meeting to share information with relatives and people within the Facebook, Twitter community of Care Rights UK. We talked about the communications plan last time. Do you feel that we need a virtual meeting to update everybody at this stage, or do you think we need some written comms to go out and update everybody with a virtual meeting at a later stage when we've got some data to share? What are people's thoughts on the communication plan in general for public out there? Any thoughts? Naomi?
Personally, sorry, Zoe, the second option. So I think some comms to go out and then a meeting at a later date, possibly. That may be more, not useful, but, you know, valid.
Fantastic. Thank
Thanks.
you.
Hi, yeah, I agree. That's exactly what I was going to say. I think some comms to go out first, let people digest that, and then a virtual meeting to follow.
Excellent, thank you. And Diane?
Yeah, I did share the animation on Facebook, which people were interested in, but I think it would be good to get to the stage where we're explaining to them the impact that this is having in reality for the care homes that are all, you know, that have actually signed up to it. Because even for me, listening to, it's really positive, and we felt that right from the beginning, but to actually hear it on the ground makes a big difference. So I think that would be really useful.
Fantastic, thank you. Excellent. And it's only 11:30. Has anybody got any other business at all? I think we've covered all the updates and it's all been very positive. I think I can see a hand up there. Is that Diane again? Diane, is that an old hand up?
I think it is an old hand, but I may as well use it as is there. Yeah. But no, the only thing I was going to say is back to what Laura said about these vaccine trials, and the norovirus one really piqued my interest, because as well as COVID, we get lots of people on our Facebook page saying that they cannot, even though the new public consultation states that they can have one person, that is still a bone of contention. Some care providers are just saying, no, I'm sorry, we've got to close down altogether because we've got norovirus in the home. So, I mean, that's kind of another issue. But I think the fact that we are getting a vaccine for it is just fantastic. So that's been another positive thing from today. So thank you.
Fantastic, thanks. And I think it's going to be interesting, Diane, actually, maybe on a regular basis we could pick up some themes that are coming through on your group as well, that we can feed back into the SOG group as well. Thank you. Naomi.
Hi, it was just actually links to what Diane just said around vaccine trials. Just more interested, Laura, to find out what do you mean by being involved in vaccine trials to get the funding?
Yeah, so really happy to pick this up, and I wonder if I don't want to sabotage the remit of this group, but maybe if there is time, then this would be something that we could have a research slot on here, where maybe we could come and discuss some ideas for potential projects. So I guess the big picture here is that we would love, over time, if it's acceptable, to use this network and link data that we're setting up to deliver research studies. And as many of you will know, research studies means all sorts of things. It can mean surveys, it can mean questionnaires, interviews, all the way through to clinical trials. And we've not talked in any detail about the kind of research that we would want to do through this network yet. So that's something that's up for discussion. Having said that, there are lots of people who would like to see lots of research in care homes. And vaccine trials are a particular area of interest on the back of COVID. And so the idea is that we know there are lots of infections like RSV, like flu, like norovirus. We obviously have vaccines for flu. We don't have vaccines for RSV at the moment, or we do now, but they haven't been tested in this population. We don't have a norovirus vaccine, but there is one that's coming online. So the drug companies, understandably, would really like to test these out in care home residents, because we know that there is a lot of norovirus in care homes, and so there's potential to really reduce the impact of norovirus for care home residents. And so it will be a question for this group and for the care homes that we're working with, as to whether that's something that might be of interest. How that would work in practice, we would obviously need to have a lot of conversations. But it could be partly funded by the drug company. It could be entirely funded by the public sector. There are different models. And it would be a case of people being allocated to receive the vaccine or not receive the vaccine. And then we would measure what happened to people who were and weren't vaccinated. So very similar to COVID, where what we did was people who had been vaccinated or not vaccinated, we looked at how many of those people got infections, how many of those people went to hospital, how many of those people died. You'd also be looking at side effects, because it would be a new vaccine. So it would be a sort of standard vaccine trial. We would need to think about whether we wanted to do this in a sort of simpler way, which would be some care homes take part, some care homes don't take part. So you have a sort of care home level trial, a care home's vaccinated or not vaccinated. Or if you want to go down the more sort of traditional route, where care homes take part and some people in care homes are vaccinated and some people aren't. But all of those sort of more technical details would be for discussion. What I don't want anybody on this call to take away is the idea that we're suddenly going to be doing a vaccine trial and no one's going to get consulted. That is not what's going to happen. It's all going to be, is this something that seems valuable for the care sector? But I do think that given the burden of norovirus in care homes and the impact that outbreaks have, I think that it's not unreasonable to think that trying to reduce the number of cases of norovirus has got to be a good thing. Yeah.
I think my more sceptical brain as a relative would be getting drug companies involved. That's a more personal, viewpoint of mine. Is getting drug companies involved. I don't know, doesn't sit well with me, but I understand, it's something that needs to be considered.
I mean, so the research would always be independent, so it wouldn't be research it wouldn't be the drug company running the study, that's for sure. The advantage of partnering with drug companies is they pay for the vaccine. And so that makes it easier to get these kind of trials funded, because obviously they cost lots of money. And the other thing that drug companies often will do is they will fund the nurses to go into the care home and give the vaccines. And that's another potential barrier. But all of these things are up for discussion. When you've got a new vaccine coming onto market, it's going to be hard to do a vaccine trial if you don't partner with the industry company, with the company. But the model for doing that, there are different ways of doing it that determine who's in charge. And I think it would be critical for us to be research funded, independent, not this is a drug company trial.
Okay, thank you.
Okay.
Thanks, Laura. Samantha.
And we'd also be 100% transparent about how we were doing that. I mean, that's obviously goes without saying. Yeah.
I was just going to say, pharmaceutical businesses, I think maybe might be interested because they want to sell the drug. That's their take on it. That's the reason why they'd be behind it, and probably the only reason, whereas the rest of us would be in it for a whole other reason. But when you get two wants that actually deliver the outcome for each side, that's kind of when the magic can happen. And I think for us with norovirus, we know it disseminates across homes like wildfire, doesn't it? And it is still being used. I've heard it myself on some of the groups as a reason not to open any part of a care home. It blows my brain. But anyway, so I think anything that we can do that can, this is what excites me about this whole group. This is exactly it. It can affect now. It's not going to affect 5 years or 10 years. If we can bring in a vaccine that prevents shutting care homes down now, then absolutely we need to be part of that, so anything that stops it, but also the extra effects like the weight loss, skin integrity damage because of weight loss, and all of those things that happen after norovirus hits a care home, it can only be a good thing, and I think people are skeptical about vaccines, and there's a certain amount of skepticism in people, but I think when they know that actually they can keep well now as opposed to keep well in 20-30 years, that's going to have a big effect. So that's what excites me about this. I think it would be just another tool in our armor, really, which we don't have today. So it's quite exciting.
I think, sorry to jump back in, I think that the opportunity here is that almost all vaccines and drugs that get developed, they're often really useful for people in care homes, but they never, ever get tested in people in care homes. So sometimes they don't work as well in people in care home residents, but no one ever finds that out because they don't do the study in that population, and they don't look at side effects in that population, and they don't look at cost effectiveness and things like that. So all the things that you need to get government to pay for those vaccine programs, you need this evidence. That's how you persuade to say, actually, if we can vaccinate everyone in care homes, it's going to reduce outbreaks by, let's say, 80%. And so that's the potential here. I think the other thing that would be really exciting is that when it came to designing these studies, great opportunity for this group, for others, to say, well, actually, we don't care about preventing hospital admissions. Maybe that's not the most important thing. Maybe care home closures is the most important thing. Or when you were saying, Sam, about skin integrity, there are all these other outcomes that won't normally get prioritised because these studies are not designed taking into account the wishes and priorities of people in care homes. So we're in a very strong position to design this in the way that we want it to be run. And yeah, I think that's something we should capitalise on. But I'm not in charge, and that's fine.
Maybe.
I think it's a great opportunity, and I think again, academia, researchers, providers, residents, relatives all coming together. This is a fantastic platform for that to happen. So I'd certainly be happy to have yourself, Laura, or somebody else from your team giving an update on potential future projects at these meetings as well, as part of the agenda. Fantastic.
But also, just from my perspective, because obviously we're having to have lots of conversations, lots of different organisations to keep all this moving forward. I would be much happier to be in a position having those conversations, knowing that this group, broadly speaking, thinks that this is a reasonable thing to do. Obviously, details to be worked out. So it would be really useful to be able to have these conversations here. Yeah.
Excellent. Thank you. Has anybody else got any other questions for providers, Laura?
I just want to ask Naomi, do you feel reassured by that, or are you still?
I do. I don't. Yeah, I do. I think I need to process it and maybe understand a bit more about it as we go on.
Yeah.
I think as a relative, I'm looking at things maybe from a different perspective to others. You know, obviously I'm not a care home manager who's seen norovirus outbreaks, or, you know, but my priority is, you know, the effects in individual, you know, on mum, and, you know, things like obviously the COVID vaccine had to be rushed through, but we're now learning there is a massive downside to the COVID vaccine as well. You know, these things can't be rushed. It takes years to test a vaccine to make sure it's safe to the people it's been given to. You know, and obviously COVID was a unique situation. Yeah.
And I guess a point on that. So first of all, it's really useful and important to hear your views, and we want all of that to input into all the decision making. But second of all, just because it's a trial doesn't mean everybody has to have the vaccine. You know, it's still a personal choice. So even if there's a trial in the care home, if you don't want to get vaccinated, you don't get vaccinated.
Absolutely. Yeah.
Lovely. Thank you. Any other questions or comments at all? Wonderful. So our next meeting is Tuesday, the 9th of April, 11 till 12. Again, we'll invite providers to give progress reports on what's happening out there. Lovely. Thank you very much.
Great.
Enjoy the rest of your day.
Thank you.
Bye-bye.
Bye. Thank you.
Thanks. Bye, everyone.